8:13. Today's 5 things. It's a special one in honor of Women's Health Month. We are launching our new Women's Health Today series, spearheaded by NBC medical contributor Dr. Tara Narula. She's going to bring us the latest research and breakthroughs to help women live their best and healthiest lives. And this morning, she's brought friends. She's got a panel of experts. And we're going to focus this morning on heart health, osteoporosis, and menopause. So, Dr. Narula, good morning.
Good morning.
You are a cardiologist at Lenox Hill Hospital. So let's start with our hearts, and we do the I would never thing. Are you ready for this?
I'm ready.
You would never ignore chest pain.
Yes, this is like the warning light in your car that goes off. You cannot ignore it. I hear too many women say it's just heartburn, it's just stress, and I always tell them, you always want to make sure it's not your heart. There are other things that cause chest pain, like GERD or ulcers or asthma or tightening of the airways or even stress.
Yeah.
But you want to rule out cardiac disease first before you look at those other systems.
Okay, you would never be unaware of certain critical numbers. What are the numbers we need to know?
Yes, so there are 4 things to know. You want to start screening for these in your 20s. Blood pressure, normal blood pressure 120/80. Cholesterol, LDL, the bad one, you want below 100. You want a normal blood sugar. We use something called a hemoglobin A1C, a marker of your sugar control over a few months. You want that to be less than 5.7. And then finally, your body mass index. You want that to be in the range of 18.5 to 25.
How
That's
often should you be
BMI.
checking those numbers, though?
You should be screening them starting in your 20s. Then if they're abnormal, doctor's going to want to check them more often, maybe every year even. So
okay. You say never be unaware of your family history.
Yes, Savannah, this is very important.
Yes.
A lot of people don't ask questions of their family, but we know that if you had a mom or a sister who had a cardiac event before the age of 65, a father or a brother before 55, that's considered a positive family history of early cardiovascular disease. There are conditions other than heart attack and stroke, like, for example, aneurysms or cardiomyopathies, weakening of the heart muscles, or even electrical abnormalities that can be passed on genetically.
So if my father had a heart attack when he was 49, I might be at risk not only for heart attack, but other items like a stroke or that kind of thing.
And you may have all your other risk factors in line, but if you just have a positive family history, sometimes that can be enough to put you at elevated risk.
Okay, you say never avoid managing stress.
Yes.
So stress causes heart attacks.
We know this kind of generally. Oh, yeah, stress is bad. But really, we have proved in the last 20 years or so that there is this real link between what happens in your head and what happens to your heart. There's, in fact, something called a stress-induced heart attack. So you can't take away the stressors, I tell my patients, but you can turn off that fight or flight response, even for 10, 15-minute intervals during the day. And mental health, Savannah, is another one that I screen for. So anxiety, depression, PTSD, all things we need to pay attention to lower our risk of cardiovascular disease.
I guess it all works together, doesn't it? And you say never avoid getting a good night's sleep.
This is something that's so easy to skimp on, right? We need an extra hour, we pull it out from our sleep. But actually, the American Heart Association, they used to have something called Life's Simple 7. They added an 8. Now it's called Life's Essential 8. The 8th is sleep. That's because we know it's so important to get that 7 to 8 hours of sleep. And then there are certain conditions like sleep apnea that we also know can lead to high blood pressure and electrical abnormalities.
All right, learned a lot. Thank you, Dr. Narula. Oda Hoda, over to you.
Hoda Hoda, here I am. I'm here with NBC medical contributor Dr. Natalie Azar. She's here to share her best tips for preventing or dealing with osteoporosis.
Yes.
Let's get to our nevers. Never wait for a fracture to start thinking about osteoporosis.
Yep, that's right, Hoda.
Yeah.
So about 10 million people in this country over the age of 50 have osteoporosis, and we will have about 1.5 million fractures occurring in those people. 80% of those are female. The issue is this. Right now, screening recommendations are that you get a bone density around age 65.
Sure.
But there are a lot of medications, there are a lot of medical illnesses, and your family history, to what Dr. Narula was saying, family history is incredibly important for your bone health as well. You may be a candidate for earlier screening, so you need to talk to your doc about that.
Okay, we're going to get to supplements a little bit later in this, but you say never ignore calcium intake in childhood or adolescence.
Yeah. So bone health is something that you need to think about. It's not something that you only start thinking about when you've been diagnosed with osteoporosis. So girls reach about 90% of their peak bone mass at age 18. For boys, it's about age 20. In your mid-30s, you're already starting to lose your bone mass. So you have to make sure, especially between the ages of 9 and 18, and especially during puberty when bone growth is most rapid, that your kids are getting enough calcium.
What's the best way for them to get it?
So look, I mean, I ask my patients, I'm always like, did you drink milk when you were younger? And so now we're going to ease right now into this next idea that calcium intake does not need to be dairy only. There are a lot of non-dairy sources of calcium.
Which brings us to the next one.
Exactly.
Never get all your calcium from supplements. Get it from foods.
Exactly. Like for so many reasons with a lot of things with a supplement versus diet, we prefer that people get their calcium through the diet. You can do, you know, soy milk, you do salmon, kale, chia, hard tofu, tons of sources of non-dairy calcium.
Never smoke or drink in excess. That's a kind of a given, right?
Right. So smoking and alcohol can both be detrimental to your health. Alcohol, I want to just make a point about, is that we're not talking about light or moderate drinking. We're talking about excessive drinking, 3 or more drinks per day.
And this is important. Never slow down or stop exercising. Are we talking about, because everyone says weight-bearing exercise is the best for osteoporosis.
So we're talking about strength and balance and coordination and flexibility. Our medications are very good at preventing spine fractures, and they're decently good at preventing hip fractures and other fractures. The majority of the fractures that happen down here, you know, wrist and hip, happen from falls. And so we want to make sure that we're maintaining our strength and our flexibility as we get older. And importantly, you want to fall-proof your home also. Non-skid pads, you know, handrails, well lit. Falls are one of the, if we can prevent falls, we can prevent a lot of osteoporotic fractures in this country.
You're right. All right, Dr. Azar, thank you. Let's send it over to Chanel.
These have been really good. All right, we're closing out today's 5 Things with Dr. Tara Allman. She's a gynecologist and the author of Menopause Confidential. So let's talk about dealing with menopause. Good morning to you.
Good morning.
All right, let's dig right in here. The first one, you say, I would never ignore hot flashes and night sweats. I think a lot of women just feel like they just have to deal with it.
Yeah, so these are the most common and classic symptoms. They're just the tip of the melting iceberg. And they're going to lead to your poor sleep, your bad mood, your brain fog, and a whole host of other symptoms. And beyond that, you're not going to be able to make your proper lifestyle choices, healthy eating, daily exercise, and that's all going to lead to your heart disease, your osteoporosis, and dementia. Exactly.
So don't suck it up. Actually talk to your doctor. Okay, next, this is interesting. You say you would never blame weight gain on perimenopause or menopause. I think some people think it's just part of aging, the gaining weight.
It is part of aging. That's what you're going to blame it on. Aging, which you can do nothing about, and healthy lifestyle choices, which you can do something about. But when you're hot flashing and night sweating and feeling lousy, it's hard to make all those important choices. So women need to really get a little bit smarter about their options when they're symptomatic menopausal women.
Which is why it leads us to number 3. You say don't be embarrassed to talk about your symptoms.
All of your symptoms. There's so many of them, but you have to bring it up with your healthcare professional because they have limited time, and you cannot be embarrassed or shy to talk about everything involved in menopause.
A lot of us, really quickly, we just go to Google and we say, okay, these are my symptoms. I know you say don't do that.
Yes, there's so much nonsense on the interweb. That's what I call it. There's disinformation and misinformation. I'm going to give you one actionable tip, which is go to the Menopause Society, menopause.org.
Okay, last tip. Never expect my obstetrician to know everything about perimenopause or menopause. You would think that they know everything.
I know. It's a shock when you find out your beloved obstetrician is really focused on delivering babies, and they do not have the time or the education to focus on midlife women's health. So you've got to partner with somebody who knows about perimenopause and menopause. We exist out there.
Okay. Dr. Allman, as always, thank you so much. In fact, for a full list of tips and more advice for your health, just scan that QR code or head to today.com. This was a good one.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.